what should we be thinking about? What should we be considering at a time like this, which feels like it might be still the beginning of this pandemic?
Well, number one, I think that we have to understand as a nation that we are only catching the sickest of the sickest patients out there. So when you look at whatever news outlet you use or online resource you're using to see the number of cases, I mean, we're at roughly about 7,000 cases here in the United States. I can double check. Let me double check that real quick here. Okay. So in the United States right now, as of 9:30 in the evening, Central Daylight Time, the number of cases in the United States now stands at 9,249. That really represents the sickest of the sick. Those are hospitalized patients. Those are patients in ICUs. Those are patients in emergency rooms who are they're having trouble breathing because of the lung symptoms that are caused by the COVID-19 virus. And so I think that one of the things that I think your listeners should really understand is that as we deploy more testing and more widespread testing over the next several weeks, we're going to see our case numbers skyrocket. I mean, I would not be surprised if next week we see well in excess of 100,000 cases in the United States, assuming that all the widespread testing that's being rolled out moves smoothly. Why is our cases skyrocketing? It's not because the infection rate is shooting up and more people are getting sick. It's that we're catching more people who probably do have it.
Right now, we're a little under 10,000 cases, but those are recorded cases. Probably literally we're over 100,000 cases. They just haven't been diagnosed because we don't have the testing capacity. Is that right?
Exactly. And the vast majority of people who get infected with COVID-19 are either going to be asymptomatic or they're just going to feel like it's a bad cold or flu, and they're going to stay home. You know, the vast majority of people who get infected with COVID-19 are going to do just fine. You know, so this is not the zombie apocalypse, you know, where, you now have 300 cases in your town, and next thing you know, your next door neighbor is eating the mailman's brain. That won't happen. All right. We're not talking The Walking Dead here. You know, I think our reasonable estimates is that for every sick person that we've got in the hospital, there are probably anywhere from 7 to 10 people out there who don't know they have it. And they may not even be sick enough to think that they need to stay home. And so that's why we're really doing this concept of social distancing, because we're trying to get people who don't know they're positive. We don't know who they are. But if we can get everybody just to minimize their social contact, stay home, don't go out, don't attend concerts, large gatherings, that slows the transmission of the virus to the general population. So when we practice social distancing, it's not about keeping us from getting infected. Odds are we're going to probably all get infected at one point or another. There are some estimates that put that maybe as much as 70% of the U.S. population will eventually get infected at one point or another, but the vast majority of us will do fine. It's that older segment of the population that we need to protect. That's the group that we don't want getting sick because of their mortality risk and the hospital course that they're looking at. We need to practice social distancing so that we don't get mom and dad sick, grandma and grandpa sick, people like that.
And if those actually a couple questions. First off, when you say 70%, is that within the next year or within like the next 10 years?
Probably over the course of the next 12 months.
Okay.
I think it's a reasonable expectation that a majority of the United States population will have gotten COVID-19 in 12 months. But the one thing to understand is that, again, this is not the zombie apocalypse. You know, a very big chunk of us are probably already have had it and didn't even know it. Or if we're going to get it, it's going to feel like that bad cold. We'll stay home for a few days and do fine.